If you ask anyone why they want to be a nurse, they have a genuine interest in wanting to help people.
As a Christian, I think it has to be a calling just because it really is a profession that you feel called to serve.
The amazing thing about nursing is just because you're a nurse, you don't have to work in a hospital. You can work hospice, you can work home health.
Caring for children, you can be a school nurse, you can be a nurse educator.
The employment opportunities are really endless.
We're all pursuing nurses that have bachelor's degrees versus an associate's degree.
Here at Charleston Southern, the BSN program, it's a 4-year program.
You start out your first semester in the nursing school, you're in a nursing home learning how to take someone's medical history, then you're in the hospital, then you're out in the community. So it helped me really broaden my perspective of what nursing really is. So I felt like I was really prepared for that.
Everything is experiential learning, so everything is hands-on. Every course is complemented with a lab or a clinical.
The simulation lab allows us the opportunity to give students a safe learning environment.
The mannequins that we use, they actually talk to us. We are actually able to hear their heart sounds and hear their lung sounds and feel a pulse. And if they're having a baby, if they're having a stroke, we get to see that activity and we get to see how we would react in that moment.
You have to take all that you've learned, all of the different interventions, all of the different medications, and then you're responsible for applying that.
If they nail it, then you know they're going to nail it in clinical. If they make a mistake, then they've made a mistake in a controlled setting, and studies have shown that they don't make that mistake twice.
Our students are exposed to a clinical course the first semester that they're in our program.
It's really nice starting early because you start to get more comfortable in the hospital setting.
We're fortunate to have partners within the community that recognize not only the value of our students, but the value that their organization brings to our students.
I'm on the Nursing Advisory Council, and it's really just a way to communicate and so that the employers and the educators can kind of share in that responsibility to produce a really great nurse.
We've been fortunate enough to have the highest pass rate for a baccalaureate nursing program for first-time NCLEX takers.
We have 2 avenues to getting a graduate degree in nursing. We have the educator track, then we have another track for our master's in nursing leadership and healthcare administration. The graduate program is fully online. The classes are 5-week classes. It's compact, it's accelerated. They only have to focus on that one class at a time. Our students can finish the program in 16 months.
All of our faculty have had some background in not just teaching, but our faculty have worked in hospitals, our faculty have worked in public health, as medics, as veterans.
Knowing that my professor has had real-world experience allows me to trust them. You could go to your instructors one-on-one and they knew who you were, they knew how you studied, they knew what you did well in and what you needed help in.
The instructors care about your education. They care about seeing you succeed. You get the small classes, you get the faith integration, and most importantly, you get a community that believes what you believe.
We have a very active Student Nurses Association that outside of the classroom and clinical experiences really give back to the community.
We partner with different community hospice cares. We're doing the March for Babies. We do the Alzheimer's Walk.
It automatically built our own community within the nursing program that we could be there for one another, study with one another.
We have students who are in nursing because they want to serve globally.
Having gone and seen a medical mission, it's changed my life. It's changed the course of what I want to do.
It does open your eyes to what's out there and what this world needs, and we know this world needs the Lord.
There's something different about us. And I truly believe it's the faith integration in the classroom.
If you are offering excellent care, you're being the hands and feet of Jesus to someone who's in need.
I don't know how many times I've heard CSU students say, that patient just told me, I don't know, but you're going to be a great nurse. And it's just because we have that faith base.
Fortunately, these hospitals see the value of our program, they see the value in our students, and without much hesitancy, choose to hire our students.
We're fortunate to have, the benefit of having a local school that is as good as CSU. The professors, they're so focused on making sure the students are prepared. I can't think of anyone that we've hired from CSU that wasn't extremely successful when they came to work for us.
There are opportunities out there and there are scholarships out there that makes this very affordable.
Not many universities or schools will help you learn to better yourself as a person, to strengthen your faith and your religion.
I couldn't imagine coming anywhere else for nursing school. If you're dealing with my family member in the hospital, I want you to be the best. So you come to CSU to be the best.